Hello, we are here today at the Healthcare Payers Transformation Assembly in the beautiful and sunny Ritz-Carlton Dove Mountain in Arizona. And I'm joined here by Ameerah Whitaker of Convey Health Solutions. So we're very happy to have you. Thank you for joining us.
Thank you.
So the solutions that Convey Health offer include technology, outsourcing solutions, and an over-the-counter benefits program that help you deliver to your members. So how are you able to keep up and meet the demands of your members in this rapidly evolving healthcare landscape?
The thing that we do most is participate in things like this, the Millennium Alliance. So when we hear feedback from our payers, we hear feedback from providers, we have initiatives at Convey Health for things like Voice of the Customer, where we make sure that our advocates and the people who are interacting with our membership have a clear understanding of what it is that the membership is looking for.
Right.
And to hear in arenas like this exactly what the health payers are looking for, what some of the challenges are that they're facing, some of the feedback that they're receiving from their membership, taking all of that into account, not just in our technology offering, but also our service offering is what helps us to stay competitive and be ahead.
Right. That makes a lot of sense. And so Convey Health, their success stems from, redefining technology and accelerating growth in healthcare and Medicare Advantage practices. So how does Convey Health utilize their technology expertise to accelerate the development of technology and services to the market?
One of our differentiators, again, is in addition to being a software vendor, a technology provider, we're also users. So we utilize what it is that we're marketing every day. So whether it is supporting for our OTC, benefit administration program, or our own internal member management, sales, everything it is that we offer to anyone else, we use ourselves. So that rapid turnaround time is based on our need to have the best performance in addition to offering that to our clients.
I'm sure that makes a huge difference.
It does. Yeah,
Right.
Internally, nobody's shy about when it doesn't work. They let us know immediately.
That's great. So navigating the complex medical Medicare Advantage and Part D landscape is difficult for most seniors, I'm sure. So how are you able to reach this audience and guide them through the complex process of enrolling into these programs?
As I mentioned earlier, our company takes great pride in providing kind of the one touch. So we have service level agreements that are focused on the member experience, not on call turnaround time. Sure. We have initiatives like Voice of the Customer where we calibrate calls. So we listen as a group too. Did the advocate pick up on all of the members' needs during that interaction, or were they focused on the primary concern? We present those findings to our teams. We look for ways to make sure that we are understanding not only the regulatory requirements that we're bound by, but also that we're taking into account all of the needs of the member. One of the panels yesterday, we talked about having that personalized care. And if you don't have the ability to recognize the multiple needs that come across during a member interaction, you could miss out on opportunities to provide the best care and service to your membership. So we focus on that primarily as one of our targets.
Okay, very interesting. Since Miramar was initially designed internally, for Convey's own business program, what convinced you to make it also available externally to clients?
So it's been around and we've been utilizing it for years. And we initially did a service and software only offering. So we would BPO on anybody's platform, or we would service things on our own. What we identified was healthcare is a really small group. And as I've experienced here over the last day and a half, everybody has that 6 degree of separation. So we all take our plan administration, we treat it like a family. So when going into an organization that's been established for years and their trouble spot or where they're having issues is their software solution, not their customer service staff, not the people who are managing their billing, we ended up in positions where we couldn't actually acquire that business because they weren't looking for service. Their solution was their problem. So in making sure that we were offering what was best in class in the market and also giving those plans an opportunity to maintain their own administration, that wasn't where the issue was. We decided it would be great if we could just market it as a SaaS solution. It gives us also the opportunity, if there are target areas where a plan needs, whether it is a staff augmentation or they need services in a particular area, we have the flexibility where we'll manage all of your billing and you can do customer service, but we're doing it all on that industry leading technology. So it worked out for us to make that
that's
decision.
great you were able to do that.
Yep.
That's amazing. And so by utilizing the best technology, engagement, and analytics, you are able to successfully provide clients with healthcare specific and compliant member support solutions. So with new technologies and trends that are emerging in this ever evolving healthcare industry, which of those are you personally most excited about?
Some of the things that we're looking into now are robotic process automation and artificial intelligence. So I use the example of you want to have as conversational as a member engagement as you can, and that gets a little tough sometimes when you're reading, navigating scripts, and doing data entry at the same time.
Sure.
So imagine an advocate having a conversation with a member and the software listening to those responses and navigating through the system and pulling up prompts that will deliver back what it is that the advocate needs, but all I'm doing is having a conversation about your needs. So that's the type of stuff that we're interested in. It also gives us an opportunity to engage and integrate with solutions that we don't provide. Convey handles the enrollment process, but we could, in that same conversation, tap into through that robotic process automation or the artificial intelligence. We can tap into things like the care management software that the plan has or the claims software that the claim has, and pull all of that back into a single instance for a customer. So those are the things that we're looking into and very excited about right now.
I could imagine this AI world, it's so relevant right now, so
It is.
very
It
exciting
is.
time.
Yes.
So what advice could you say to C-level executives who are looking to stay ahead of these new trends and how it's going to impact their healthcare industry?
Continue to participate in things like the Healthcare Transformation Forum. It is an amazing opportunity to not only interact with your peers, but also with vendors or other plans to get an idea of what's trending. What are they looking at? What are they into? What things have they encountered that you can collaboratively look at eliminating some of those burdens. And also having good partnerships. I think that is the difference. I think a lot of people look at vendor relationships as vendor relationships, but when you establish those partnerships and you make sure that you are all working toward those common goals, it gives you a better opportunity at achieving success. So that would be my recommendation. Stay engaged with our community.
Right. Good to know. And so we're very excited that Convey Health is here at this Healthcare Payers Transformation Assembly. And I'm just curious, what do you think are the benefits of attending this small, intimate setting for a program like this?
Having the opportunity to hear directly from the executives what it is that they're looking for, where they've achieved success, and what their challenges are. Sometimes you end up having relationships and developing interactions with people who may not be aware of the decisions that are being made at the top. So having an opportunity to sit down, and even if just for 30 minutes, with an executive who may not have any interest in what it is that we're doing specifically, but just understanding their landscape helps us to stay abreast of what's happening in the market. So I appreciate the opportunity just to have those conversations.
Yeah, well, we appreciate having you.
Oh,
So thank you
thanks
so
very
much for
much.
being here.
Thanks, Kat.
And thank you.
Thanks.